The coronavirus gets its name from the crown-like spikes on its surface. It is usually harbored in wild animals like bats, then spreads to an intermediate host before infecting humans through evolution and mutation, finally spreading among humans through human-to-human transmission. The major infection source is the SARS CoV-2 infected patients. It is mainly transmitted through respiratory droplets and close contact. Sometimes, asymptomatic carriers are potential sources of SARS CoV-2 infection, and anyone can be infected regardless of gender or age. Currently, we have limited understanding concerning SARS CoV-2, but we have learned from the SARS virus, which bears some striking similarity to SARS CoV-2, that it can survive for several minutes and up to 3 days, depending on the environment. Below are the tips you need to follow to prevent infection. First of all, wear a disposable medical mask or surgical mask when you are outdoors. How to correctly wear a mask? Hold the mask so that the stiff bendable strip is on top and the collar side facing outwards. Pull the top of the mask over your nose and the bottom of the mask over your mouth and chin. Mold the metallic strip over the bridge of your nose from the middle to both sides. Adjust the mask and it should fit snugly over the face. Gloves or goggles are not necessary as a routine practice. Secondly, wash your hands regularly. Wash your hands after returning from public places, after coughing or sneezing into your hands, after taking off masks, before and after meals, and after touching dirty objects. It is important to wash your hands in the proper way. After wetting your hands, be sure to use hand sanitizer or leather soap evenly over your hand and scrub carefully. Rub your palms together, as well as the back of your hands against your palms, and rub from your knuckles to your fingers for at least 15 seconds. Rinse your hands thoroughly under running water. Thirdly, regular disinfection is required. Skin can be disinfected by wiping with or soaking in 75% alcohol. Objects such as mobile phones, keys, and door handles can be disinfected by wiping with 75% alcohol or chlorine-containing disinfectant. But do not use different disinfectants at the same time to avoid the generation of toxic substance. In addition, ventilation needs to be properly maintained. 2 to 3 times a day, no less than 30 minutes each time. It is possible that central air conditioning can spread the disease. Therefore, the use of central air conditioning should be stopped or reduced during the outbreak. What if you were infected? It's different for each individual. Some show symptoms, while some don't. Signs and symptoms may develop after an incubation period of 1 to 14 days, mainly between 3 to 7 days. The main symptoms of COVID-19 include fever, dry cough, and fatigue. Others include nasal congestion, runny nose, sore throat, myalgia, and diarrhea. Abnormal chest CT scans may be found in some patients. For suspected cases with above symptoms, patients are mainly diagnosed through the following 3 ways. Real-time fluorescent quantitative RT-PCR assay for detecting SARS-CoV-2 showing positive. The DNA sequencing result being highly consistent with the known structure of SARS-CoV-2. SARS-CoV-2 specific antibodies were detected in serum samples. Even if you are showing symptoms, do not panic and trust the doctors. Prognosis is good for most patients. Only a few will be in critical conditions. One last reminder, make sure you rest well, eat light, drink plenty of water, do not eat wild animals, exercise moderately, and stay positive during the outbreak. Let's fight against the coronavirus together.